Okay, I want to talk about tear troughs. We're going to release a couple of different series where we go over the tear troughs and what it is I'm looking when I see tear troughs. And so I wanted to really break it down and explain what's going on in my brain when I have a patient come in for tear trough filler, and who I think is a great candidate, who I think is an okay candidate, and who I'm just a hard no. So first thing I'm looking at is going to be pigment. A lot of times patients will come in and they'll be complaining of, brown pigment or shadowing or whatever it is. And so I will really look at the pigment of their skin. And sometimes if they have a lot of hollowing there, that means I'm actually getting their head up in the light and spreading that skin to make sure that there's no pigment that I'm seeing. If I am seeing brown pigment, filler will not help with that. In fact, it may make it worse, because as I take the shadow out, now that pigment is there. Now, can you cover that up with makeup, concealer, things like that? Yes. And will it look great? Yeah, because the shadow is now gone, the hollowness is gone, but that brown pigment is still there. They will need to treat that with hydroquinone, retinols, lasers, whatever you want, but that pigment will not go away with filler. The other thing with pigment is going to be if it's a natural purple or blue pink hue to it. So if they have that natural hue to their under eye, there's a reason for that. That skin under our eye is the most thin skin on our entire body. And so what you are seeing is the vasculature underneath that skin. And so that pink kind of purple bluish hue is from that. Filler is not going to get rid of that either. In fact, it may make it more apparent. So these are all things that I'm going to really look at and discuss with the patient beforehand. Now I ask them, is it your hollowness or is it the crepiness of the skin that bothers you? If it is the crepiness of the skin, then that is not a filler. That is going to be collagen stimulation. You need your microneedling, you need your lasers, or you need a lower bluff. If it is the hollowness, so true hollowing, loss of volume, then that's when you can look at filler as an option for that. If patients, always actually, not even if, always assess the cheek first. If patients have hollowing in their cheek, if they have that volume loss, both medial cheek, apex of the cheek, lateral cheek, anywhere in that cheek region, treat that first. It has to be treated first. I know this from experience. If you do not and you put filler in there, then this volume is going to be sticking out and this is going to be gone and you will have a lump. It's going to look awful. You have to be able to create the support structure for that filler under the eye to look good. If they have a good cheek volume, then you could probably just get away with doing just the tear trough filler and you wouldn't need anything else. If they don't, make sure you do that cheek first. If they have good, or they have this big fat pad, right? You always hear if they have a big herniated fat pad, don't do their filler. I've had success with it, but only in the cases where it was really what they needed was cheek. If they have no medial cheek and they have this little hanging fat pad here, you can really minimize that fat pad by supporting just their cheek. It's not actually tear trough filler at that point, it's just cheek filler. And I've had really, really, really good success with it. However, my hard no is if they have that herniated fat pad and good cheek volume, don't do it. It just never works. I've tried, and every single time I come back disappointed. Because really it's surgical at that point. They need to get that fat removed and then repositioned. Trying to add volume, if they already have a good cheek, it just makes the whole area look worse. It can even make that hollowing where that ligament is. It's not really a hollowing, but where that ligament is pulling, it can make it even deeper. So if they have a fat pad and they have good cheek and a little bit of hollowing and you go and put more in there, sometimes it can make it even a deeper, more noticeable, prominent hollowing. So that's my hard no. I won't do that one. If you want to see my actual technique in action, then that would be the Tier 2 Patreon. So you can join there and watch it. We'll be posting that. Otherwise, you can learn from the assessment and get what you can and try it and see. I will say the tear trough is the most delicate area to treat. I think the lips take the most finesse and the most artistry. The tear troughs take the most delicacy. You have to know which plane you are in. You have to feel comfortable to be able to say, yes, I am super periosteal. Other little tidbits with this is you have your orbicularis oculi muscle, which is actually adhered to the bone. So there's a lot of questioning of whether you can actually be under that muscle because it's adhered. You need to be as close as you possibly can to that bone. And then understanding your depths. That layer is your safe layer, and then superficial is your safe layer. Those are your only two safe depths. If you get into the muscle, it could look great for a month or 6 months, and then it could migrate and you could have a problem where you didn't even place filler. It can be pushed out. So I think having a good working relationship with those that you're doing tear trough filler is going to be extremely important because they are problematic. They are beautiful, and when they work well, but it has to be a relationship that you have with your patients where they know you're going to take care of them. And if they come back in 6 months because something isn't quite right, that you are making sure that you are taking care of them and having that look good. Lymphatics is another thing to consider. As our drainage system in our face is present. If you are placing filler, it could cause a little bit of sluggish lymphatics, and you may be able to see that in the presentation of more swelling. So if they wake up and the more swelling, if they have a cold and they have more swelling, allergies, they eat a lot of salt, drink a lot of alcohol, anything like that could cause more swelling, then I'm not going to be putting more in. So I will do the treatment, I'll wait a month, make sure that they are okay, that they haven't had any problems, and then we can reassess and do more. So I go very, very slow in my tear troughs as well. If you have any other questions with this, make sure to let me know, but we'll definitely go over it more in the video, and so you can learn more there. But let's get into the assessments.